Okay, so fatty liver can be biochemically, fatty liver can be divided into five different classes based on etiology or the reason. We can divide fatty liver into five different types: type 1, 2, 3, 4, and 5. In which type 1 is due to the overfeeding of fat, that is, the excess of fat consumption. Type 2 is due to oversynthesis of fats from carbohydrates and proteins, right? And type 3, which is also known as physiological fatty liver, in which what is happening, the excess mobilization of fats from the peripheral tissues or from the depot to the liver. It can be due to increased utilization of fat as fuel. That is, it may be due to starvation, diabetes, etc., or carbohydrate deprivation and all. Then there is type 4. Type 4 is due to it is the pathological fatty liver, and it is due to the absolute or the relative deficiency of VLDL secretion. That is, VLDL synthesis may be inhibited. It may be due to the synthesis as such will be blocked, or synthesis will be happening, but the liver may not be able to secrete the VLDL. So as a result of which, what happens, the TG will be getting accumulated in the liver. Right, so resulting, so it is known as pathological fatty liver, and it can lead to injury, toxic injury to the liver, right? And it is one of the it is one of the most important dangerous causes for the development of fatty liver. And there is last one, type 5. Type 5 is not due to any other factors or any other overfeeding or underutilization and all. Type 5 is due to the impairment or deficiency of the vitamin, that is pantothenic acid, B5 or pantothenic acid, because we know that pantothenic acid, the biologically active form of pantothenic acid, is CoA-SH. So CoA is very much required for the fatty acid synthesis, metabolism and all. So if there is pantothenic acid deficiency, what is happening? The CoA formation, coenzyme A formation will be blocked or inhibited or lowered, as a result of which what happens? The beta oxidation will be prevented. So fatty acid will be getting accumulated. So this is another reason for fatty acid or fatty liver, right? So these are the five different causes. So these are the five different types of biochemical classification of fatty liver. But clinically, fatty liver can be divided into alcoholic fatty liver and non-alcoholic fatty liver disease. So the alcoholism, we have already explained, alcoholism results in excess of NADH formation. So this NADH thus formed, it has to be converted back into the NAD. So there is no one to accept this NAD. So oxaloacetate itself, what they go and accept the NADH. So instead of continuing the TC cycle, oxaloacetate undergoes reduction to give malate. As a result of its TC cycle is blocked, so it can result in the cell death, right? So the cell becomes fibrotic, and this condition is known as liver cirrhosis. Right now, another reason is, even though a person may not be alcoholic, then also in some cases the person may have fatty liver, and that condition we call it as non-alcoholic fatty liver disease. So non-alcoholic fatty liver disease or non-alcoholic, it is also known as steatohepatitis. Steatohepatitis, that is, bile secretion will be blocked. It's all. So it is one of the most common reason for the liver diseases, where the fat is getting accumulated due to high fat diet and uncontrolled diabetes. Right? Earlier we have classified the fatty liver based on the biochemical reasons. So clinically, the same reasons are coming, but the condition we call it as non-alcoholic fatty liver disease. So how can it be prevented? So the chances for the development of fatty liver can be prevented by the consumption of a class of molecules which are known as lipotropic factors. So what happens? Why does a cell becomes fibrotic? Because the normal consistency of the cell is lost. Because a normal cell is having abundant cytoplasm with nucleus and all other cell organelles laden in it. But when there is excess accumulation of fat, what happens? This fat droplets infiltrates into the cell, and it occupies the majority of the cytoplasm, right? Pushing the nucleus towards one side, and it finally resulting in the bursting up of the cell, right? So this makes the cell dead, and such a cell we call it as a fibrotic cell. It cannot carry out the normal function. So this is when the fibrosis extends, it results in the condition known as liver cirrhosis. So how can it be prevented? It can be prevented by a class of molecules known as lipotropic agents or lipotropic factors or lipotropins. So which are the lipotropins or lipotropic factors or lipotropic agents? They include choline, inositol, then lecithin or phosphatidylcholine. There are essential amino acids like methionine, right? Essential fatty acid, that is polyunsaturated fatty acids. Then antioxidant vitamins, that is vitamin E. Then similarly selenium. Selenium is a mineral. It's very much essential. Then vitamin B12, folic acid, then synthetic antioxidants, etc. So all these molecules, then lecithin, it has not mentioned here, but lecithin is very much essential, right? So all these molecules can prevent the chances for the accumulation of fatty acids in the body. And hence, these molecules are known as lipotropic factors or lipotropic agents or lipotropins. And this phenomenon in which they prevent the fatty liver is known as lipotropism. Okay, so these are the factors regarding the fatty liver. Now, there may be some genetic reasons for the synthesis and degradation defects in some persons, and we call it as inborn errors of lipoprotein metabolism. So, which are the or they are known as primary disorders of plasma lipoproteins, or can also be known as dyslipoproteinemias. So, which are the different types of lipoproteinemias? There are A beta lipoproteinemia, in which the defect is there is absence of chylomicrons. The person will not be able to synthesize chylomicron. So what happens? The TG, exogenous TG cannot be taken into the liver. Similarly, VLDL synthesis will be inhibited. That is, endogenous TG also will not be transported, and also LDL will be also there. It's not working, it is also defective. So what happens? Ultimately, the lipid metabolism is affected. So what happens? The intestine and the liver will be getting accumulated with fatty acids. So intestinal malabsorption will be happening. So this condition is known as A beta lipoproteinemia. Now another condition is familial alpha lipoprotein deficiency. So there what is happening? The HDL is absent. See, it is A beta lipoproteinemia. So the name is given based on the electrophoretic mobility, right? So A beta lipoproteinemia results in the defect of synthesis of chylomicrons, VLDL and LDL. IDL also will be coming there. While alpha lipoprotein deficiency results in the HDL defect. So hyper TG or hypertriglyceridemia due to the absence of ApoC2, low levels of LDL, atherosclerosis can be affecting, right? Then there is a Tangiers disease, fish eye disease, ApoA1 deficiency, etc. So these are the hypolipoproteinemias in which the lipoproteins are found in reduced quantities, right? So Tangiers disease, fish eye disease, ApoA1 deficiency, all these are deficiency disorders, defect. That is reduced quantities, reduced synthesis. Now there is hyperlipoproteinemia. So what do you mean by hyperlipoproteinemia? There is excess production. So familial lipoprotein lipase deficiency. So LPL deficiency, what happens? LPL defective lipoproteins will not be broken up, or they will not be subject for catabolism. So what happens? The lipoproteins will be getting accumulated. As a result of which, what happens? High TG levels due to deficiency of LPL, then abnormal lipoprotein lipase, ApoC2 deficiency, so inactive LPL, etc. So there will be slow clearance of chylomicrons and VLDL, then there will be reduced levels of LDL and HDL, but there is no increased risk of coronary artery disease because TG and VLDL are not getting accumulated in the blood vessels. Right? Then there is familial hypercholesterolemia, in which there are different types. This is type 1 hyperlipoproteinemia. This is type 2A, in which hypercholesterolemia is there. They're defective LDL receptors. So LDL is there, but the receptors for LDL are defective. So what happens? The LDL cannot come and get bound onto the peripheral tissues, right? So there is elevated LDL levels in the serum. So as a result of which LDL transports cholesterol. So there will be elevated cholesterol levels. So there are chances for atherosclerosis and coronary artery disease. Now another type is familial type 3 hyperlipoproteinemia or broad beta disease. So here what is happening? Deficiency in the remnant clearance by the liver is due to abnormality in the ApoE deficiency. So there will be increased chylomicron and VLDL because the ApoC and ApoE will be from the HDL should come and bind onto the chylomicron. So there is ApoE is defective. So there will be chylomicron and VLDL remnants will be getting accumulated, resulting in hypercholesterolemia, xanthomas, atherosclerosis, etc. Xanthomas means there is bulging in areas of the skin. That we call it as a xanthomas. Okay, that is fat. Fat ഇങ്ങനെ അവിടെ ഇവിടെ ഇങ്ങനെ വന്ന് സ്കിന്നിന്റെ അവിടെ തന്നെ ഈ സബ്ക്യൂട്ടീനിയസ് റീജിയൻ തന്നെ അവിടെ ഇങ്ങനെ മുഴ പോലെ ഇരിക്കുന്നുണ്ടാവും. അതിനെയാണ് we call it as xanthomas. It's nothing but a deposition of fat. Fat ഇങ്ങനെ അവിടെ ഇവിടെ സ്കിന്നിൽ തന്നെ നമുക്ക് when we palpate, you can feel അവിടെ ഇവിടെ ഇങ്ങനെ ഒരു ബോൾ പോലെ ഇരിക്കുന്നുണ്ടാവും. It's nothing but fat. അപ്പൊ അതിനെയാണ് we call it as xanthomas. Right? Then familial hypertriglyceridemia, that is type 4. There is overproduction of VLDL due to glucose intolerance and hyperinsulinemia. That is, insulin level is very high, as a result of which glucose intolerance is there. So there will be overproduction of VLDL. That is, endogenous TG synthesis will be increased because there is excess of carbohydrates. So carbohydrates will be converted into fat. So these fats are incorporated into VLDL. So when there is increased glucose level, what happens? The VLDL synthesis, TG synthesis is elevated. So naturally VLDL production also will be elevated. So there will be high VLDL, high cholesterol, but there will be low levels of HDL and LDL. So maybe it may be due to alcoholism, diabetes, obesity and all. Then hepatic lipase deficiency. Hepatic lipase, that is hormone sensitive lipase. So what is happening? Deficiency of this enzyme lead to accumulation of TG, rich HDL and VLDL remnants. So patient will be having xanthomas and coronary artery disease. So these are the various types of lipoprotein disorders. And you will be preparing an assignment on these lipoprotein disorders by the next class. Okay, so primary disorders are there. We can divide the lipoprotein disorders into two types broadly: hypolipoproteinemias and hyperlipoproteinemias. And what is Tanger's disease? The name condition, the Tanger's disease itself can be asked for the exam. So you should know what is a Tanger's disease, what is the reason, what is the defect, what are the characteristic features of Tanger's disease, fisheye disease, then familial alpha lipoprotein deficiency and all. So the lipoprotein disorders can be broadly divided into two types: the hypolipoproteinemias and hyperlipoproteinemias. And again, since they are all inborn errors, maybe it will be inherited in the family itself. So that is why it is known as familial lipoprotein deficiency. So it is running in the family. This is a genetic defect. Okay, so majority of the diseases are, especially the hyperlipoproteinemias, are familial in nature. So that is, the conditions are running in the family itself. Okay, so the make an assignment on the lipoprotein disorders of lipoprotein metabolism or plasma lipoproteins, or this lipoproteinemias. Okay, so with this, the fatty liver, the lipoprotein metabolism is over. Next is the cholesterol biosynthesis or cholesterol metabolism. Okay, so hope you have understood.